In this short piece, I want to talk about mental health. We used to talk about people getting really stressed. Now we're much more proactively talking about mental health and accepting of the fact that everybody has mental health. Some people have good mental health, some people have poor mental health, and most of us bounce back and forth between the two. So organisations like mine will say things like it's 1 in 4 in any year, 1 in 6 at any given time are struggling. So that's definitely millions and millions of people in the UK alone on any given day. So we know that it's out there, and I like to think that this really simple cartoon that somebody once gave me illustrates exactly what we're talking about. Now, if you're talking about really serious mental health issues, physiologically driven mental health issues, perhaps like schizophrenia, psychosis, post-traumatic stress, and hormonal issues about baby blues and that sort of thing, that accounts for about 15% of mental health issues, and that's what you might put as really serious stuff, where you need to be really talking to a doctor and maybe taking medicines and that sort of stuff. But 85% of it is really depression or anxiety, which can be equally serious and debilitating, of course. But if you want to break that down, depression is essentially merely thinking about things that have happened in a negative way. And now we all do that all day, every day, but depression is really where you do it to an extent that it gets in the way of you being able to function in your relationships and in your job. And as you can see from the list, it's talking about things like regret and so on. The one thing you really want to avoid is bitterness. Bitterness is acid to the soul. But a cognitive behavioural therapist would say, look, every minute spent thinking about something that's already happened, unless we're using that as a learning event, is a minute wasted. It's gone. Be in the middle. Be mindful. Be in the present. Anxiety is basically, of course, thinking of things that haven't happened yet in a negative way. And it's all sorts of fear and worries and anxieties and so on. And again, a cognitive behavioural therapist would say, look, every minute spent thinking of something that hasn't happened yet is a minute wasted from actively working to prevent it happening. So it's a very simplistic but true analysis of the situation. And again, really, anxiety, we all have fears, we all have worries, we all have issues, but it's when those worries actually get in the way of us functioning in our relationships and in our work when it becomes problematic. Which brings me on, of course, to the way organisations are responding to these issues in the workplace. The first one, as in the previous video, bikes and bananas initiatives, free fruit in reception and subsidised memberships of gyms, which help. And of course, mental health first aiders. A lot of organisations spending time and training their people to be mental health first aiders. And that's an excellent thing. But a lot of people are saying that response is really mirroring what happened with behavioural safety back in the day. Talk to everybody about their behaviours, tell them not to do it, it'll be fine. And it became something of a tick box exercise. See, the problem with mental health first aiders is they are an element of a good holistic approach, but they're only a key element, and they might not necessarily be required at all if you've got a really strong, caring culture where everybody is looking out for everybody else. But just to illustrate what I mean by that, I want you to imagine my first week at work. But back in the day, I worked at Lamworth Steelworks for a week. And I think I went there on a motorbike actually, but imagine my mother takes me and drops me off as a 16-year-old. And she's met by the supervisor who says, now Mrs. Marsh, it's true that we have hot metal flying around everywhere. We have forklift trucks charging up and down like a Grand Prix. We have noxious gases everywhere and a horrible bullying management culture. But don't worry about it because Tim will be fine with us. We have 5 highly skilled first aiders out there that will look after him. Now, she wouldn't have been very reassured by that, nor should she. So, in summary about mental health first aiders, they can be extremely useful, but they really should be a key element of a holistic, integrated strategy, and not necessarily required at all if the overall culture is caring, supportive and empowering enough. So really, an organisation needs a 4-part strategy in 2 parts really. The first one is a mindset piece where you know that lots of your workers will be struggling inevitably, no matter how good your culture is. It's just such a widespread issue. Something will be going wrong out there. Like Andrew Hopkins' mindful safety culture, there are always things going wrong. You can respond to that by crossing your fingers, or you can get out there and proactively try and find out what's going wrong. And when you've found people who are just on the edge of hitting critical with their struggling, you can signpost them to occupational health, to the Samaritans, to your employee assistance programs. The second strand is again in two pieces. The first one is proactively we can try and create an environment where the worker is less likely to struggle because they're getting the benefits of good work is good for you. So on an individual level, what we can do is we can ask those questions we talked about previously and try and tweak the job so that it best suits the individual. And of course, things like getting the balance of homework, the balance of autonomy, skill use and development, etc., right? And of course, the final piece is to create a culture that is strong, supportive, empowering, engaging, where there's respect, where there's high levels of fairness and trust, and which is the glue that holds absolutely everything together and generates a workplace where good work is good for you, and you're actually happier and mentally healthier having a job like that than not needing to work at all.